and Friedman for this invitation to speak at the District A711 Annual Convention, and thank you for coming to this session. By now, you all know about this terrible, often deadly virus. As you can see in this illustration, the spiky virus and enters usually through our airways. It primarily affects the lungs. However, it can affect almost every other organ and can enter the body through other tissues also. During this session, I'm going to talk about impact of COVID-19 on health, mine, yours, and ours. What has been done and being done, the future. Pandemics. If I may take us back to 100 years ago, the influenza pandemic, also known as the Spanish flu, 1918 to 1919. Millions of lives lost in every country. Then came SARS in 2002, relatively mild in most countries, but hit us hard here in Ontario, especially in the GTA. 2012 came MERS, Middle East Respiratory Syndrome. 2019, COVID-19. This virus is more contagious and deadly, and as we are now seeing, it mutates frequently and has become more contagious and more virulent. We know that it started in Wuhan, Hubei province in China, initially thought of as a flu or respiratory illness. It soon spread rapidly across the world and took many, many dear ones. Italy and the USA were hit hard. In March 2020, declared as pandemic by WHO. Here in Canada, in January 2020, our government became alert to the virus. In March 2020, the public was advised to return from March break, and other vacationers were asked to return home by March 18, 2020. We went into the first lockdown on March 18. Everyone remembers the panic at that time, the run on all paper products, the shortage of toilet paper and of tissues, wipes, hand sanitizers. The lockdown closed businesses, schools, and all non-essential services. We were not prepared. Elderly patients in long-term care were hit hard. Elderly lying alone in their rooms in the LTC, dying alone without the support of loved ones. And an equally difficult time for families, not even being able to say the final goodbye to their loved ones. The images from those times were clearly heartbreaking, weren't they? Coronavirus around the world. As of April 1, 2021, there have been a total of 128 million confirmed cases, 2.8 million total deaths, 12,000 new deaths daily 56-day trend, approximately 664,000 daily infections 56-day trend. I have talked about the story of the pandemic and the virus. How did we deal with this? At first, with denial. It was thought that this illness would be short-lived. It could not be possible to hit us, especially the young folks amongst us. Soon enough, it was realized that hospital admissions were rising, ICU admissions were rising, that there was a desperate shortage of respirators, and the number of deaths started to increase. We realized that the lockdown would continue. Industries were closing, people were asked to work from home, children to stay home, learning online, or parents became teacher, educator, and a friend. Daily life changed. Mounting stress. People feared of travel. Those who had traveled to contact the strangers and of falling ill. Stress, mental health, and physical health was affected. I will first talk about the stress. Stress is a normal physiological response to an abnormal situation. It is part of our lives. It enables our body to adapt to positive and negative events, situations that we have all faced. For example, taking an examination, being hauled up to the principal's office, are but two common ones we face as children. As adults, more significant ones include loss of job, finance impacted, emotional distress, isolation, loss of loved one, poor relationships, substance abuse became as an outlet. Future. Here I have put a slide. We see on the right, the lady who is happy doing her job, managing all aspects of her life. On the left, we see the lady working from home and sloppily dressed, hair not done, in weeks or months, working from home and at the dining table, dishes piled up, take out food containers piling up. Here we see two individuals, man and a woman, showing effect on heart, on the brain, the body functions because of stress. These persons are feeling agitated and distressed. The effects of long-term stress can be more insidious. The economy suffered huge losses and many businesses have not yet recovered. Remember, restaurant industry hit hard. We all like to go out for dinners and which we cannot. This has become foreign. All of these aspects affect our peace of mind, causes stress, affect mental health. Yes, the government helped by providing curb and other similar assistances. Were these enough? Most people will say no. Assistance was also provided for health and other health-related issues. Stress can cause one or many of the following. This is a busy slide, but I will go over this. Emotional aspects, fear, anger, sadness, worry, numbness, frustration, physical, effect on appetite, increased or decreased. Many of us have complained during this COVID, have gained 20, 30 pounds. Energy decreased, no interest in pleasurable activities. Concentration suffers. sleep up or down, physical health problems worsening, chronic health problems worsening, mental health problems worsening, and people can resort to increased use of tobacco or alcohol. Anger becomes difficult and frustration short fuse. We know that. Is getting into arguments, conflicts, relationships affect, marriages are becoming difficult, children become irritable, and siblings argue and fight. Helplessness, hopelessness, and boredom are important aspects that are affecting us. Children. Initially, during the lockdown, children were happy. Hey, we have days off. Soon realized that children grew saddened and they realized that the lockdown is affecting their academics, their social life, and soon the graduating class of 2020 were unable to have their graduation ceremonies, proms, and hoopla associated with that. I'm going to take this example of this lady, a 32-year-old woman of Mexican descent. She lost her job because of COVID. She has 2 children, age 2 and 5 years old. Her husband is working in construction industry, and with his long hours is not available to provide any help with the kids. What are the fears of this lady? Oh my God, how will I cope with my day, with children, cooking, cleaning, finances? No support available because of isolation. What happens? She may suffer a combination of symptoms that I have listed before. So loss of jobs, minority groups affected, socioeconomic groups, low socioeconomic groups, stress of working from home or not working, parenting, and uncertainty of future. I have put this slide to remind us again the pandemic-related stressors. Stress. Coping with stress. What is important? Take care of your body. How? Eat healthy, balanced meals, and some exercises, aerobic or otherwise, breaths, deep breaths, stretching, meditate. And there are any number of YouTube programs which help us with, say, meditation for anxiety or sleep, yoga exercises, and these are free. Get plenty of sleep. We need 7 to 8 hours sleep. Avoid excessive alcohol, tobacco, or substances. Continue with routine, which is whatever you used to do before, you should continue with that. And if there are health problems, take advice of your healthcare providers. Get vaccinated when vaccine is available, and it is available now. Take breaks from watching TV or movies, reading, listening to news stories, but have a control on that, not use it all day long, because negative stories will be doom and gloom. Make time to unwind, connect with others. I have put here organization that we belong, Lions Club. Similarly, there are many organization, volunteer groups, which have helped to remain connected with people. Give a helping hand to less able. Be a lion, be a zoomer. This is clearly not a good work-life balance. This is better. Good work-life balance need flexibility. Here is a physician who may have to work longer hours or shifts Does he get burnout? Yes, but they develop coping mechanisms, what we have been talking. Be with friends, be with family. Spirituality is important. Whichever is your faith would give you peace of mind. Remain connected with your community. Remember my slide that I had said that lady was working from home and was feeling distress. How did she do it? She developed her different mechanism. Stay connected, talk with spouse or others, new programs on media, and understand them to relax. Now coming to mental health versus illness. Mental health and mental illness are increasingly used as if they mean the same thing, but they do not. Everyone has a mental health, just like everyone has physical health. As the World Health Organization famously says, that we do not have mental illness, but we do have mental health. In course of lifetime, not all people will experience a mental illness, but everyone will struggle or have a challenge with their mental well-being. That is mental health. Just like we all have challenges with our physical well-being from time to time. You, me, we would have done in our life saying, I need to have a mental health day. That was a positive thing. And it was a good thing to do to take care of your mental health. Mental health symptoms. I have gone over some of them, but here I will focus on bereavement. Bereavement is important, and it is because of loss of loved ones. How did we cope during pandemic lockdowns with funerals and others? By Zoom. We still showed our support to our friends, families who lost their loved ones. This is, many people have been facing increased level of alcohol and drug abuse. Insomnia is lack of sleep. Meanwhile, COVID-19 itself can lead to neurological and mental complications, such as delirium, agitation, and stroke. People with pre-existing mental, neurological, or substance use disorders are also more vulnerable to COVID infection. They may have a higher risk of severe outcome and even death. I'll come back to this point a little bit later in my presentation. Stress, anxiety, and depression. We talked about stress. Anxiety and depression may affect physical symptoms, psychological and emotional symptoms, and behavioral symptoms. Anxiety. What does anxiety mean? Anxiety is a vague, unknown fear, threat. It manifests itself when we believe that a dangerous or unfortunate event may take place, and we have no coping mechanisms available to us. We worry about the situation, feel insecure, overwhelmed, and powerless, have negative vision, and are discouraged. When anxious, one can experience heart symptoms like heart racing, fainting, sweating, rapid breathing, and the fear that I'm going to die. Depression. What does depression mean? The dictionary defines depression as a passing state of being upset, discouraged, and sad. When these symptoms stay continuously all day for weeks and months and affect physical health, and coping with life becomes clinical depression. At times, people may think, why I'm living, and needs medical attention at that time. Other comorbidities worsen, mental health problems worsen and increase social isolation. Remember this case that I was talking about? Let me come back to this one again. What is she feeling now? She's crying all day, not eating, not sleeping, snap at children, angry, and fighting with husband. These symptoms have continued for 4 months. At times, she has thoughts that why I'm living. What is she feeling? She's anxious and depressed. What can she do? First thing is take stock of coping mechanisms in the past. For example, we all have taken examinations for graduation, and the examination is important because that examination is going to give us qualification to work. You seek help when we are unable to cope with the project or seeking help from a friend, teacher, mentor, and succeed. We get anxious and worried in pleasurable situations as well, like milestones, birthdays, anniversaries, weddings. Check how you managed planning, working at that time. We sought help. We are resilient and we bounce back. That's what it is. We bounce back. When symptoms continue, seek help from family doctor, specialist. Seeking help is a sign of strength, not weakness. I have put resources to seek help at the end of this presentation. Self-management strategies. I have talked about some, but I would like to say some more here about set up a regular routine. That is, every day has certain things that you need to manage. Important, get up at the same time. Spend some time outdoors. Daylight exposure is important, and you may have heard about SAD, that is seasonal affective disorder, which can be corrected by light therapy. So natural light is extremely important. Focus on being calm. I had mentioned about meditation and such. Cooking and eating healthy, exercise, social interactions. Avoid naps. It's important. If we nap, we are not going to be able to sleep at night. As I said, we need only 7 to 8 hours. If you nap for 2 hours, you're not going to sleep 7 hours at night. Avoid bright lights, computers, phones, etc. So I have gone over about health, how it has affected mine, yours, and ours. Now I'll go over what has been done and being done. After acceptance, it is pandemic, PPE for healthcare providers, protection became top priority, and we have been encouraged masking, hand washing, social distancing, waiting for the vaccine. Vaccine is now available, and many of us probably have received or you have registered. Volunteer groups such as TNLC Lines played a good role in this. Government did their part, testing, tracing, tracking. As I said, vaccine is there. Do get vaccinated. So medical help is there. Medical health care is provided virtually, and when essential, in-person assessment or treatment. The future. You see this variant of the virus. This virus is more contagious, as we are hearing. P1 virus is more deadly, and it is affecting even younger people aged 30 to 60 years. That is disheartening. Remember, I had mentioned that I'll come back to the neurological symptoms. I prepared the talk, and then I saw this in Globe and Mail, published in Lancet Psychiatry on April 6, 21. Those of you watch National, you may have heard. Research has found that 1/3 of people affected with COVID in long term, like months now, have been affected with neurological or psychiatric conditions. And the psychiatric conditions are anxiety and depression. This is just to say that which variants and from where they have come. I mentioned about the residual symptoms, neurological sequelae, and it is being considered as infection, inflammation affecting the brain cells. This is the post-acute sequelae of COVID. And in this study, also, they are saying 30% were affected with neurological symptoms. That's for the future health. So we talked about the future. When large population is vaccinated, we will have herd immunity. Prevention by masking, hand washing, and to make our life more social at the moment is greatly restrictive. Hopefully soon it will be improving. Most survivors, we have done well. Together we can do it. I would like to add a few words about our Toronto Netralia Lions Club and how it helped us all to cope with this difficult time. We worked together, stayed in touch, had regular meetings. Virtually, of course, we learned to Zoom. We raised some funds for PPE. We raised funds for food banks. We raised funds for Food Save Up or service providing cooked vegetarian food to the needy. We organized yoga, exercise sessions, and educational activities. We organized music nights for pleasure by Lions and for Lions. I believe that all these activities of Lionism in action kept us connected, entertained, and reduced stressors, in addition to giving us a feeling of achievement and a feeling of self-worth. Just emphasizing what we need to do to stay safe. Thank you for your attention. I haven't forgotten my promise of resources. And here is the list of resources. I will now try to answer any questions that you have sent me or you may have. Thank you again.